Can't see the flag. Oh yeah, there we go.
Hi, Charlie.
Okay, you're live. Thank you.
Thank you. Good evening, everyone, and welcome to another Town Council Budget Workshop. Today is Thursday, May 6th. I'm going to call the meeting to order, and if everyone can please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to public comment. This portion of the meeting is specifically set aside for comments from the public who are asked to limit their comments to 2 minutes. Any person interested in providing public comment should email publicmeetings@rockyhillcp.gov or call 860-258-7682, and you will be provided with a link to attend the Zoom remote meeting and instructions on how you will participate. And so moving right into our budget, paragraph A, we have the health district. And I believe you all got a supplement in your packet via email from the Central Connecticut Health District. And welcome, Charles Brown. Nice to see you.
Nice to see you too, Madam Mayor.
And we're ready when you're ready.
So first off, let me just share some good news. As of this afternoon, Rocky Hill has actually come out of the red alert status for COVID-19 and is now in the yellow, not even in the orange, but in the yellow. So the cases have dropped down significantly. So that is something definitely to smile about, all of you. We're very happy to see these cases going down, and it's a direct result of a lot of the hard work that you guys have put in along with our folks to really be able to make these case numbers go down. So I thank you for all the support that you've given the district as we've continued to work towards the end of this pandemic. As far as our budget is concerned, our Board of Health met and they actually voted for an increase in the per capita charge for our member towns, going from $6.45 per capita to $6.60 per capita. For Rocky Hill, that particular increase is $2,824, bringing the total amount for the year up to $132,759. The reasons for the increase are that we have increased insurance costs, salaries increases according to our collective bargaining agreement, and anticipated costs for accreditation expenses coming up in the coming year. With that, I stand ready to answer any questions.
Okay, great. Are there any questions of Mr. Brown?
Oh, just a quick question. You know, I guess we start off by saying thank you for what you've done the last year. You know, we know it's been crazy busy for you guys, and I guess this is what you guys prepare for and hope it never happens. And lo and behold, I guess it happened.
Yeah.
The only question I had, and it's a real minor one, in the budget book we received, the requested amount was $131,753 versus the $132,759. So I assume it's just updated since the budget book.
The budget book was an estimate.
Yeah.
Okay.
And then after the book went out, Charles's group met and finalized their budget. So it's a slight increase up to 132 and change.
Okay, so it's just an adjustment to the budget book. That's all I was asking.
Yep, that's it.
Are there any other questions or comments?
Go ahead, Chris.
And you can just save this for last. Not sure what Ed's question, but just while you're on, I was going to ask Charles, who should get vaccinated for the COVID vaccine, and is it safe?
Who should get vaccinated for?
Yeah, well, there's I guess a perception of young people shouldn't get it. Just
Oh,
want to
no.
give you the opportunity to clear that up. Who should get it?
Yeah, let me take this opportunity absolutely to do that. So yeah, anybody that has the ability to get a vaccine at this point should get the vaccine, and we're especially looking for the younger population to be vaccinated as they can. We're looking potentially next week. There are potential of opening up to 12, the 12 to 15 bracket. And even though the younger population does not show significant, harm from this particular virus, or has not up to this point, herd immunity is critical, and their inclusion in the vaccinated really is critically important to be able to do that. So anybody that has the opportunity to get a vaccine should do so. Right now, there is more than enough vaccine to be able to be had, and some interesting incentives right now to be able to do so at various places. I know the Yard Goats has the baseball game with 4 tickets and Dunkin' Donuts, and there's a variety of things that are opening up to try to incentivize those people who may be a little bit on the fence for this. But really, the best reason that I can think to get a vaccine is to protect not only yourself, but your family, your friends, and your community. It really is a matter of civic duty, and we're not going to be able to beat this particular pathogen unless we have a significant number of our young folks that actually take the opportunity, do the right thing, and get that vaccine.
Hey, Charlie, my question was around the grants on your budget. I think several of them are not going to be, grants, I guess, are non-reoccurring by nature, but the public health preparedness grant, that was special to this year, and the COVID, right?
No, the public health preparedness grant has been actually a grant that's been going on almost for 20 years now.
20 years?
Well, since 2002. That was the original cooperative agreement that started planning for preparedness back after the anthrax attacks in 9/11. So there's been a grant on the books, and that's it's dwindled over time. That's one that actually has brought our preparedness coordinator down to part-time, is paid through that particular grant. We were actually covering salary because he was working as a health inspector as well, to keep him in a full-time status. COVID kind of took care of that, and really he's been focused entirely on preparedness and COVID response since last year. So some of the grants, like the ELC COVID grant, is new grant funding that we've actually received. There is the potential for additional funding from other sources as we get into Recovery Act dollars, but right now we have no projection and can't really count them into our budget.
And just on building on Chris's comment, it's maybe more helpful to know who might be cautious in getting their vaccine, right? There is a group of folks that need to very much follow their physician's guidance.
Mm-hmm. And really, anybody that has significant medical issues should consult their physician prior to receiving any medical treatment, including vaccines. But that's one of the biggest reasons that we have for those who are able to get a vaccine to do so. Because the more people we have vaccinated, the less opportunity that virus has to spread within the community and spread to those people who cannot get a vaccine. That's the whole concept of herd immunity. Being able for us as a herd of responsible communities, being able to not allow that virus to have any traction within our communities by vaccinating everyone that can get it.
Thank you.
Any other questions or comments?
Just real quick, and this probably maybe for another time for you to come visit us, Charlie, but now, I know there's other things you guys have to look for, and I know COVID's been so encompassing, but what are some of the things that are also kind of you're looking at as we move through spring towards summer that we need to be aware of?
Well, I mean, moving through spring to summer, we're definitely looking at all the vector-borne diseases. We've had a fairly mild winter. So tick-borne diseases like Lyme disease, ehrlichiosis, babesiosis are things that we definitely want to pay attention to, especially as the weather gets warmer and people are out there cleaning up their properties. So that and the regular vector-borne diseases that we see. So West Nile virus through mosquitoes. We see now triple E, Eastern equine encephalitis, are things that we do have to guard against. And as you mentioned, you know, our work doesn't stop just because we have one virus that's in the mix. So, you know, people do, as they're taking care of their properties, eliminating water, standing water to limit mosquitoes is something that we're definitely going to be encouraging as we move further into the season.
Thanks.
See here, I thought I was going to only be talking about numbers.
Charlie, just on that last one, Charlie, one of the services that I'm not sure the public's aware of that I just found out about last year, we had a really bad tick season this year. I think it's probably gonna be another bad one this year. You do offer services where if people get a tick, you know, on themselves or their kids, it's kind of gross, but we can drop it off to you guys and you'll tell us what's going on with it. Is that the case?
Yeah, we actually send it to the Connecticut Agricultural Extension Station, and they do testing on it, identify what type of tick it is, and if there's any pathogens that that particular tick is carrying, along with whether or not it's engorged or not at the time that they send it in. So we do that free of charge. So folks do happen to get a tick on them or on any of their loved ones, please bring it in there. We ask that they don't bring us ticks off of animals like their dogs. That's not things that they actually test for. We're only looking for ticks that are actually on people.
Anyone else? Okay. Well, Charlie, thank you so much. I mean, on behalf of the whole council, we have really had such a tremendous working relationship with your district because of your leadership. And I can't imagine what it must have been like. And I'm really happy that we're in a different place now than when we first had these conversations. I mean, we're not out of the woods, obviously, but man, what a difference. And
yeah, there has been some late calls and late nights and a lot of worry and stress, and this beard was not nearly as long or gray as it was at the beginning of last year. But I will say that the support that we've gotten from all of our towns has been outstanding, and we could not do the things that we do without you. So your support and leadership, along with all of the council, really does help. Both in communication and the things that you asked me that we're able to share, along with your leadership within the communities to encourage them to do the right thing for public health and for their communities.
well, thank you for guiding us and stay safe.
You're welcome.
We'll talk to you soon.
All right, thank you. Y'all have a good night.
Thank you.
Bye.
Okay, let's move on to B and turn our page to 56 and 57 in our book and welcome the ambulance presentation.
Before Joe gets started, just want to point out that the major increase in the ambulance budget relates to adjustments made to the volunteer pension plan. It was about a year or two ago. So this is really the first pension valuation that was done under the new terms of the pension plan. So that's why you see a stark increase in that line. Other than that, pretty much it's everything that the town contributes to the volunteer ambulance stayed fairly stable. So with that, I'll turn it over to Joe.
Thank you very much, John. Yeah, looking over the budget, I over the last few years, we changed radio systems to stay in touch with the police department and the fire department. And we've increased our radio purchases. And I saw in the budget that we have 7 new digital radios, which is actually the perfect number that will bring me even with the members that we have. But the dollar amount was not added into the budget for that. And the radios are $23,1657 each. So for a total of $16,215.99. And I was just wondering if we can have that added in also to the budget at this point.
Did you buy any radios this year, Joe?
They've been on order. We've had an issue getting them through Motorola. So the ones that we have on order will bring us up to 62 radios, and we currently have 70 people writing. So with the 7 new ones, that will bring us even. That will have, everybody will have portable. So
Joe, what was that total again?
I'm sorry, 16, 20, I'm sorry, 16,215, 99 cents.
Okay.
So along with that, we're between COVID and purchasing all of the COVID supplies, we've recently purchased the 3 CPR, Lucas CPR machines to assist us in doing CPR, also because of COVID, to try and keep our people safe and not over the top of patients, potentially with COVID. And we just received the bid. We'll be purchasing an ambulance. The new ambulance is $252,000. So we've been saving our money up for that. And we just awarded the bid last Friday, and we'll be signing the paperwork and getting it built and hopefully receiving it within the next 4 months. So other than that, we're up to 78 members. Everybody's doing great. And out of the 78, we have 70 current writing members and 8 individual staff members assisting behind the scenes with all the administrative details. Any questions?
I got a question for John. John, in the budget summary, group insurance 7150 is to purchase $20,000 of life insurance for each active member. Should that be restated to say group insurance 7150 is to continue to fund 20,000 of life insurance for each active member? Because it looks like it's going out to purchase versus continuing to fund.
Yeah, it's the, yeah,
Okay, all right, thanks.
yeah, it's technically the premium. Yeah.
Yeah.
Okay.
All right. Good job, Joe. Thanks.
Thank you.
Are there any questions or comments for Joe?
Oh, sorry, just a quick question. The amount for the radios, where in the budget will that show up? Because on this page, I don't see any place for like ambulance equipment. So I don't know if that's more of a John question or
They'd show up in contributions.
as part of contributions. Okay.
Yes. There's other items they buy over in the past that rolls up into that account.
Gotcha.
So would that make the line the 16,215, or would that be the 16 in addition to the 10?
The 16 addition to the 10, the $10,000 we use for medical supplies and training equipment. We currently are also purchasing CPR mannequins. They're approximately $2,500 a piece. And we use the CPR mannequins to not only train ourselves, the public, also recertify the police officers and the firefighters. And fit testing supplies, the software to keep us in touch with dispatch, and medical supplies that we also fill for the police vehicles and fire department. And a whole bunch of other miscellaneous stuff. But most of the money that we're spending is for us, along with supporting the other emergency agencies, the police department, and fire department.
Okay. I don't
Joe,
hear any other questions.
one
Oh,
other
go
thing-
ahead, Jeff.
No, no.
Oh, Alan. Okay.
Joe, can you or John just explain how you gather money to be able to fund another ambulance that doesn't show within the budget particularly?
I'm sorry, I couldn't hear you. You were breaking up.
The revenue that comes in that you collect, I assume, is what you're using to fund the ambulance.
Correct.
Okay, and that money, can you just explain a little bit how that works? Because I'm not sure everybody that may be listening is aware that, you know, that you generate revenue through the ambulance as well.
Right. So after we started, it's probably been a little over 20 years now. Every ambulance call that we go on, we have paramedics available. And when we initially started, the paramedics were charging a paramedic intercept charge to the patients that we helped. The volunteers wouldn't charge anything. And unfortunately, the way Medicare works and Medicaid, they will not pay for the paramedic level service without a transport fee. So we ended up getting forced to start billing. So we bill the insurance companies and on any ambulance transports that we do. And the money that we recover from that, we have saved up over the years to support purchasing all of our major equipment, including the ambulances. Our last 6 ambulances that we've purchased, this will be number 7. The volunteers have saved up enough money by all of our transports to pay for all of those. And like I said, the new ambulance is $252,000, and it's had no cost to the town. So all of our major expenses, ambulances and large equipment, our ambulance stretchers themselves are $33,000 just for the cot that we put the patients on and wheel them into the emergency room. So that's where all of our money goes, is back into between training, equipment, and ambulances right now.
Thank you for explaining it for anybody that wasn't aware how that comes about.
Any other questions? Okay, well, Joe, thank you for your presentation, but more importantly, thank you on behalf of all of us for all of your efforts during the pandemic. It blows my mind that you operate a volunteer organization that was under such stress, not because of guidance, but because of a major pandemic and yet everyone was there and going to work and had their heart in it, which is a true testament to your leadership. And, we can't thank you enough as a town or as an administration for everything that your men and women do. So thank you.
Thank you very much. I have 78 amazing members, and they just really stepped up to the call, and we had more people actually wanting to volunteer, wanting to ride the ambulances at the height of the pandemic than we had equipment for. So I couldn't be more proud of them, and I greatly appreciate hearing that, and I'm sure they will too.
Wonderful. Well, thank you for your presentation. Have a great evening.
Thank you so much.
And we are going to move on to C, Human, Youth, and Senior Services, beginning on page 68 and 69, Human Services.
Yes, before Melissa starts, just one update. After the budget books went out, we were notified that we're having a couple retirements in the budgets. So Lori Stanczyk's retiring from Youth Services, and Denise Sanderson is retiring from Senior Services. So what we're going to be doing is we're going to be splitting up human services so that it's there'll be human and youth services under Melissa. And then going forward on senior services and a minibus, we're looking to hire a director of senior services for the new community center. And most likely, we're going to be doing some rearranging as far as between the parks, human services, and the human and senior services locations in the new community senior center. So the budget was prepared under different circumstances, and there could be changes coming down the road, but Melissa can go over how it's currently structured, and we'll go on from there. Thank you.
Good evening, Madam Mayor, Deputy Mayor, Town Council, and Town Manager. Good evening to all. I would just like to take a minute to put a few things out there. I know last year, and being one of the last directors to go for the department, I know a lot of people wanted to mention their staff, but this is sort of really important to me this year, given what the town manager did just say with having some retirements makes it sort of extra special. But last year was very trying on all of us with COVID, but I need to do more than just thank my staff. I feel it's really important to publicly put out there that it really was an honor and a privilege to work with this amazing group of very talented professionals in this office, starting with masks and cleaning products and hand sanitizer to immune compromised people, all the way through the pandemic to scheduling the COVID vaccine clinics and working with the health department on that. My staff navigated the VAM system over the phone and trying to help people do that and schedule things. We provided food, check-ins with people, supplies, rides, companionship, and everything else in between. This is included and not limited to performing dance recitals in driveways. We don't need to elaborate on that, but trust me when I tell you, there were a few assessments done in that form, but the smiles it brought to people's faces was definitely worth it. We adopted approaches and programs, outreach and communication to reach out to families and their loved ones. So many adult children and family members from out of state really worried about their families and calling, and we were sort of the in-between. My team here exemplifies exactly what it is we do. We service humans and their needs. And I think that kind of says it all in this department. So to Nicole, to Denise, Lori, Bill, Santiago, Charlene, Christina, and Dave, I want to thank you all for being amazing at what you do and for figuring out how to be even more amazing at what you didn't know how to do, which was, we figured it out, and I'm proud of them for that. I want to just throw out there as well and mention volunteers and everybody in town who stepped up to donate. This is an amazing community, and I say that often, but our department relies a lot on volunteers as well as donation base. So when we couldn't take donations for the food pantries, people sent checks so that we could order through Amazon, and people called when they were homebound and said, I'm younger, I'm healthy, I know some people can't leave their homes, what can I do? We had donations of PPE, we had community members making masks. We had it was amazing to see the community come together, and we were able to provide what we were because of those volunteers. And I think that deserves to be mentioned. So to all of you, you are my unsung heroes in this pandemic. So I know the town manager did mention Lori Stanzik, who is our coordinator for youth and family services, has been here for 31 years. So she will be retiring along with Denise Anderson, who has been here as well for over 30 years in our senior center department. And so there will be a huge void, and it's very bittersweet for us, but we obviously wish them well. And moving forward, we're going to have an impossible task to fill their shoes, but I know that with some reorganization and focus and uplifting news about moving past the pandemic, that everybody will be in a good space. So I'm looking forward to that. We are going to continue to work on programming while we are attempting to have an office move as well as program changes and department changes. So we have a lot coming up this year. And that kind of brings us to the reason that we are here. We only have a few line items that were increased, and a lot of that is best guesstimation. So I have heard a few other directors mention this as well. We are up against some unique challenges because as the Human Services Department, we are facing sort of a longer term, like we really have to step up now because a lot of the aftermath of COVID is sort of what we're going to be seeing and dealing with. And when I say that, I mean mental health side, financial side, psychological, physical for seniors who have been in their homes. It's sort of the recovery process is where we are going to sort of be expected to step up and have to really continue to figure out how to help people recover and move on. So I think that we made a few increases and tried to do the best we could. But again, that is, you know, as an example, one of the line items is evictions. And we've already seen 4 in the last 2 weeks. So I really can't figure out exactly what that's going to look like, but we're going to have to do the best we can this year and go from there. So the other increases in our budget, like many others, are contractual. And if there are any specific questions, my staff is on and ready to be able to specify if I cannot. So if there's any questions, we can go from there.
All right. Anyone with any questions for Melissa?
Just briefly, because I was going to ask about the evictions, that I assume you're anticipating more. Is there something that the citizens or the people can do to assist you in, any kind of types of donations or gift cards or something that would be of benefit?
Not specifically regarding evictions, but I appreciate that asking. Certainly, we are always in need of any donation base. So gift cards and things of that nature that we always put out there. Again, we do a lot of programs and have adopted a lot. The whole staff has really come together in all components of human services to sort of help provide services as far as, delivering or providing a meal with take-home activities. And we've really tried to incorporate intergenerational concept this year and I can give you some examples of that later. But as far as the evictions go, Mimi, specifically, those are like state mandated. So I will implore anybody who is out there or who is listening or might be in a difficult situation when it comes to their housing to reach out and ask the questions, because the earlier we can get on that, certainly the better. But as far as evictions, as of right now, the state statute is being reviewed and being looked at as far as it being falling under municipalities. But as of right now, it does for a set period of time if there is an eviction. So there are certain processes that have to be followed, and therefore that comes at a cost for us for storage and moving and all of that. And unfortunately, I think with not only a drastic increase in evictions, but as well as for a lot of residents that find themselves in that situation, they probably have lost income or were furloughed or laid off. And so it's sort of a snowball effect economically. So I'm not sure what can be done in that particular instance, but certainly anybody in that situation probably needs help in other ways. And therefore, any sort of donation base that people are inclined to offer would always be utilized to the best that we certainly can and much appreciated.
Thanks.
You mentioned the retirements that we're facing, and first I'd like to echo your remarks. Thank you for providing them about the contributions of your team, and thanks for the folks who've served for many decades our town and helping deliver services. Could you describe a little bit about what that looks like for moving forward? Is there going to be a transition period? Is this going to be effective at the same time? What does that look like as we kind of go through that period where we're losing some longtime members and then onboarding new ones?
Well, I'll do my best. I wish I knew
Will you take
exactly
that
what
one?
that looks like. We are all sort of doing our best. I know that human resources is working. We've been going back and forth as far as Lori specifically for youth services. Her full-time position will be going out on the webpage if it wasn't up today. So we'll obviously be looking for somebody to fill that slot and get them in here. A lot of what Lori does in her department there is state mandated and grant funded. Therefore, it's imperative that we get somebody who has the right qualifications and hopefully experience. That's very important. But I know that, and as John mentioned, the senior services will be going into its own department. So I can tell you that both of these amazing individuals are working very hard to set curriculums, as we already have, for summer programming, to set up everything that needs to be done, ordering supplies, sending out applications, really trying to stay on top of it so that we as staff that are here can continue on with those programs and help incorporate new employees that come in to help pick it up and continue on. So we're hoping for little to no disruption, but we're going to do the best we can.
Any other questions?
Just a question, and Missy, feel free to defer to John on it. With the realignment of the various departments, how is that going to affect your department logistically? I thought we were bringing everybody together in the new senior community center, and I don't know how that's going to, how is that going to affect the flow of intelligent?
Alan, I think we are bringing everybody over to the town hall complex. So we're looking at how to structure it correctly, but we can use the parks department as well as the new community senior center office space as well to see what works best for that operation. But Melissa's operation will be in that town hall community center complex so that people would be able to go, if they were at the community center, it'd be easy to walk over to see Melissa's group.
And then the follow-up to that, John, is obviously the budget book's going to be changing. Will you be providing updates to your best guesstimate so we could kind of get a flow to what we're going to be looking at for a finalized projected number?
Yes. These budgets we're incorporating some increased costs associated with opening up the new center in a larger building, opening and having, providing more entertainment services and so on. So there will be some adjustments to it, but it shouldn't be a great number. But as things get rolling along, unforeseen costs could be incorporated in there. But we'll do the best we can to try to get an update projection for what we think it might look like when the community center does open, depending on our search for a senior center director.
Okay.
John, just to go off some of Alan's comments, I'm thinking, wouldn't the two new hires for youth and senior come in a little lower than what's full-time salary currently?
Well, the youth service is a union position, and that will probably come in at a lower starting salary, based on experience, due to the, I believe that union does have steps in it.
Mm-hmm.
The director probably will come in higher than the current amount budgeted for, but for what it worth, I'm not sure exactly what that dollar amount will be.
Okay, I mean, one thing we may want to consider, and we can talk about this, I'll bring it up when we talk about senior services, is I'd be a firm advocate on either a senior manager in that department and a part-timer to help out we've all gone through, the past 4 years of understanding this is going to be a bigger effort than it is today. And it may need more staffing. So I'll bring that up when we talk about senior services.
Are there any other questions? Okay, so why don't we go ahead and turn to pages 70 and 71, youth services.
I don't think there's much change on this page at all.
Okay. Are there any questions? Any comments? Okay, we will move to pages 72 and 73 on the minibus.
Also little to no changes. This one is pretty straightforward.
Okay. Any questions, any comments? I presume you've all read this, so I'm just going to move forward quickly. Senior services, pages 76 and 77.
Are we looking for questions on senior services?
Is there anything you wanted to say, Melissa? Or
I don't have anything I'm happy to answer whatever I can.
Okay.
Along with the town manager, obviously, because this will be removed.
So Melissa, I do have a question here, and I know we've had this conversation, and I've had the conversation with Councilor Thoreau as well. Senior lunches has been a topic of conversation. Obviously, we haven't been providing them during the period of COVID, but we're looking at a significant increase to our budget line item. And I guess my understanding is it's a subsidized lunch program. But there's no way for anybody that's willing or able to pay more than the subsidy to contribute additional for the lunches. Is that, am I stating that somewhat correctly, or?
I'm not sure I'm clear on what you're stating. So we provide this lunch, yes, for a nominal cost. This line item supplements the lunch program. But there is no, if you're asking me if this is specifically for residents in need, no, this is open to all seniors.
We purchase a lunch, and then we charge the senior that wants to eat at a certain dollar amount, and the town subsidized the difference. The program has been getting popular, and thus increasing the town's costs and so on. But also incorporated in that number, Alan, is some startup money for our cafe that's going to be there as well. So it's like a two-prong, the senior lunch as well as what we think will work in the or be popular or requested in the senior cafe, so that we can provide snacks and refreshments probably during the morning hours, when probably the senior center will be greatly used, even though with the expansion of the center with more rooms, we can open up more activities for seniors in the afternoon. But it's a combination, that food line between the lunch program and the startup for the cafe.
I mean, Councilor Greenspan and I have talked about this before, and you know, I am a senior. I don't go often to the lunches, but once in a while, I have, you know, some of my friends that, you know, they want to say, like, let's get together. And quite frankly, I don't have a problem of spending my money. In fact, I'm kind of like embarrassed to pay the nominal fee. And I don't know. I know they do it in the schools. You have reduced lunches and you have free lunches, and you have people that pay. Well, it's still subsidized somewhat, but you know, pay the regular amount. And you know, maybe it's something to consider going forward, that if there's some way to do it so that's confidential, you know, they buy tickets from, you know, human services or something like that, or from the senior coordinator, and you can get a reduced amount if you need it, but you know, it might be a way to save some money. And I would assume the cafe, once it's stocked, is going to be like a break even, or have we thought about, I don't know if we've thought that through yet. Is it going to make money? Is it going to break even, or are we going to subsidize that as well? Just throwing it out there.
Have we thought about that, John?
Was that break even on the lunch program?
No, on the cafe.
I guess we'll see what people will be interested in. We would always like to try to break even, but as I say, we're not really sure what people will be wanting. I'm sure we won't be providing any hot food or anything like that, but at least we be providing beverages and so on. So the intent for something like that would be to try to break even as much as possible.
Yeah.
Because really anyone can come in there, right? And the whole community can come in there and have, grab snacks, coffee, cinnamon buns, whatever you're putting out.
We're looking towards increased volunteers. So if we could have a volunteer as opposed to a town staff having to work the cafe, and have some sort of rotating schedule or something like that. And then if we do provide food, you know, we charge what our costs would be, and hopefully we'd have a turnover so that we wouldn't have waste that would increase our solid waste dumping fees. So, but yeah, that would be the intention, was hopefully to have that break even. Would be a goal.
Yeah, John, so talking about break even, I was asking you last time about what is the subsidy on the lunch. Can you give me a number?
I think what lunches go between $8 and $10, Melissa, generally. And when we close, when we stopped serving, I think we were charging $3.50 a senior for the senior lunch program. A good chance that number should be increased to.
It's actually a little bit higher than that. I checked with Denise today. That's the base lunch that we pay for the meal. That does not include the beverage, the utensils, the dessert, all of that. So on average, it runs a little bit higher than that, our actual cost.
We would add $3 to $5 more onto the food price. So it could be from 11 to $15. That's included with everything.
Sure. So $15 with everything, and we charge right now $3.50. Is that correct? Done right. And keeping that in mind, if we change nothing, although I like Councillor Thoreau's idea here, if you don't change anything, how many more people you're estimating, Melissa, to use this service going forward as we have expanded facility?
I think we'll have a significant amount given the programming that we're opening up. I know there's some added in the budget line for senior activities to allow for, especially the first few months, for seniors to be able to come in without having to cancel programs. If in fact they're just getting up and going with open houses, I expect that number certainly to grow as people become comfortable and have space to move around, and also are in the center for activities. So I expect that number will definitely continue to increase exponentially.
Okay, thank you.
Can I just say something? Just remember, I know that we're separating and I've enjoyed working but we have to think about too, if we want to fill those programs, you need support staff. Along with the job I was doing, getting programs up, also helping seniors file for federal, state services. So you really do need support staff. Hiring a director is a great thing to separate the center and making it their own department. But I think we keep forgetting about support staff. That's
Okay.
That was one of my biggest things that I've always was asking, for the last 7 years.
How many people are in your department, Denise?
Me.
Okay, then. And so you have,
I'm working with other people, but as also, I'm just senior center coordinator / municipal agent.
So is there someone who floats between you and youth services and
No.
senior services, like a coordinator or?
No.
Okay.
I'm the admin, everything, just like Lori.
And you have
Denise, you do get help on the lunches.
Well,
right?
the
Yeah.
lunches, yes.
We do have help from that.
Right,
And,
Charlene will help with the lunches.
And one of the custodians, Nick,
He picks up the lunch,
picks up and helps.
we'll serve.
Denise, is there any room in the part-time budget, like the part-time salaries budget, to get you that help without, having additional line item there? Like, there is a part-time salaries budget, right? I'm just thinking like, can your support staff be supported in there? Or can be paid for in there, I should say.
Well,
There's money in the part-time line put in there for services in that
And that's what I was,
$34,000 line.
and that's what I was alluding to, John, kind of going off what Denise was saying. I've been seeing this for the past 5-6 years. It just seems like she's got so much on her plate. And, when I look at the Pivotal Express, it seems like every other activity is call Denise, or email Denise. And that's why I'm saying, as we go into this next phase with the expanded senior center, that maybe not a director level salary, but maybe something a little less, where we can put that savings into additional part-time for support to be able to take care of some of these added, because there's going to be added programs and services and things like that. Not only part-time salaries, but senior activity to bring on more teachers and things like that for these activities.
I would mimic the same request for youth services. I've been by myself for 8 years now, so youth services could really use some support staff as well, especially after the pandemic, and mental health that's going to be coming our way in September is going to be amazingly large as far as families and children in need. And one person is not going to be able to do all of that. I've assumed several different positions over the last 10 years, losing staff year after year. I have no contractors. I have no interns. I really have no one except volunteers from the point of family members of youth that I work with that offer their help.
So Denise,
sorry, John, go ahead.
You had come in with the Hartford grant a couple of years, or Kathy, I think, had done that or something. I remember
over 20 years ago.
Oh, was that long ago?
Yeah.
You're dating yourself now. Do you think that would come into play for a part-time position for at least a couple of years for the senior center, and a part-time position for youth?
I think we can look at it, but I thought with the Hartford Foundation, they go for full-time. So if you can get an ad person to do full-time between two. But again, if you're putting the senior center as their own department, and youth services is still going to be under human. I mean, I can look into it and tell Missy, and she can get back to you.
Well, I mean, it was kind of mixed when seniors were under Parks and Rec. So you had people going back and forth a little bit. But I mean, that's something, John, maybe something somebody can look into is a Hartford grant for another full-time position that operates between the two.
Yeah, just Hartford Foundation is sort of, I thought they were just funding nonprofits that are related to this COVID situation, COVID. So
I think I think they expanded that criteria, but
so
I don't know if they took away from their original plan.
So I don't know whether they suspended doing other type of grants.
Yeah, but I'd be supportive of that because I could see what Denise and Lori are saying too.
Yeah, I don't see why it wouldn't be something that, instead of the 2 part-time, that if, you're doing combined services, you wouldn't have one person who would be working with both of the departments and coordinating those efforts. I mean, that's kind of common. That would make more sense, I think. So, food for thought, right?
Right.
Are there any other questions or comments? I think I had a question. I'm sorry. I'm going to just flip back through my budget. Maybe not. I don't want to beat this to death, but just with respect to the lunches, how many folks are coming in now for lunch?
Before the pandemic, we had 15 to 20.
Oh, okay.
Yeah.
But not a major amount.
Some days less than, but it could be, if I'm not mistaken, correct, Denise, Fridays was a busy day.
No, Friday was
sorry,
a very
Thursday when
Thursday, correct,
Thursday was
yeah.
the busy day, and we could have
Monday, Tuesday, and Thursday were the busy days.
Right, with the card games and the bingo.
Right.
Okay. And does that have an age, age requirement or?
Just listed seniors, so the senior age, but there is no other questionnaire as far as need based. It's just open to any senior.
I guess I'm just wondering, what is senior age now?
Well, AARP considers everybody at the age of 50 a senior. So,
yeah,
some centers go 50, 55, 62. It all depends.
We've pretty much in human services follow the 60 and above.
Okay. All right. I'm just, it's just, we want to be fair and, once all this, multi-generational wonderful things that you guys have going on and people are going to want to come to this center and hang out, there's a lot of us who are 50, right? So it potentially could be a much bigger expense than we anticipated. And so I don't know if we maybe need to sort of work on that number in anticipation of that. But, something that, we just need to be mindful of, because I imagine once word gets out, it could grow and we may not have that money available. Okay, well.
I think it'd be interesting to have a non-senior rate. I'm not sure what happens now. The pandemic's changed a lot. One of the things, a lot of people are working from home now. At some point, they'll be able to get out in the world and safely, have lunch. I guess you can do it now, but, it might be more open to doing that. I know, for example, my office shut, so we're all working from home indefinitely. So, there might be a place, either the cafe or for lunch, where maybe folks want to go there. We have a lot of restaurants in town, so I don't know how many people we would pick up. But if there's if the focus is on intergenerational programming, maybe a non-senior rate might help offset some of that cost and keep it, subsidized for the seniors who do use it. And then other folks who aren't quite there yet might be able to take advantage, something to consider, depending, of course, on what we see, once we're open up and the world's back to a little bit more normal.
Yeah. Yeah. At
And
this
I
point,
think if we're talking about that too, we might want to consider having a vegetarian option because we have a significant number of people in the town that may not eat meat, and that might increase the number of people that come. So just throwing it out there.
yeah, absolutely.
Good point.
Okay, so, well, Melissa and ladies, thank you very much. We appreciate your presentation, but more importantly, we appreciate everything you did. And you're right, Melissa, when you take us back to like where we were, last March and panicking, what are we gonna do about masks and women sewing them, men sewing them? It was an incredible outpouring from the community, but equally important, it was a lot of work for you guys. And it's very helpful for you to let us know and the public know precisely what's going on in that office, because I don't think people recognize the strain that's put on our departments, but especially yours. And it's not ending, right? I mean, there's going to be all kinds of,
it's just
beginning.
Mhm.
There's going to be all kinds of federal funding coming in and expectations and counseling needed and all types of services. And I think your tasks are going to grow exponentially. And we want to be cognizant of that. So we appreciate you sharing and have a wonderful night.
Thank you. You as well.
Thanks.
Okay.
Good night, everyone. Thank you.
All right, we'll flip backwards to pages 46 and 47 and look at fire and specifically the supervision section, and welcome Chief Garahy.
Thank you, and I have to say the last session was very informative. I just found out I qualify for senior lunches. So pays to keep the volume up.
But you're not going to get a preferred price, Mike.
Okay, thanks, John. I want to start by thanking the council for this opportunity to review our budget tonight. And Assistant Chief Cromis, full disclosure, is in the room here with me. He and I would also like to extend our gratitude to our membership. Our membership performed to the highest standards on a 24/7, 365 basis. I couldn't be more proud of them. We're an all hazards department. And just to give you an idea of the magnitude of our members' commitment, the troops individually left their homes over 11,000 times this current fiscal year to answer calls for assistance. Just amazing on their part. With that said, we began our budget process in January with a very deep dive into a needs assessment. From there, we were able to create a budget that was limited to only the absolutely necessary items and services needed for the year. There are some increases, but we did our best to keep them to a minimum, although some were out of our control. So thank you.
Thank you. Are there any questions? I'm just going to pause for a second in case someone is maybe looking at something. All right. Should we move on to prevention, Chief, pages 48 and 49? Or if you're all set? Are there any questions or comments on prevention from the council? We are quiet.
Quiet's good.
Quiet's always good.
Yep.
Okay. Why don't we move to pages 50 and 51, firefighting? I suppose I should ask you, Chief, is there anything that you want to point out?
I think in firefighting, Mike, you want to point out the increase in pension?
Well, yes. As with the ambulance, we're part of the volunteer, town volunteer pension program. And our pension commitment also did go up this year.
And is that payment a more of like a one-time bump to get us to a certain level, or do we think that'll be the new level moving forward?
I gotta defer to the town manager on that one.
Well, I think most likely maybe this is the peak, and we should see it declining. Again, also reflected in it is the growth or losses in the pension assets. So if the pension assets continue to grow as they have been over the past year or so, then that would assist in bringing that charge down.
But moving forward, I mean, you mentioned this is the peak, it should decline, but we would, I think, anticipate that it would be closer to what it is now than what it was the previous year.
Yes, yes.
And John, just to follow up on that, this is an actuarially computed number that's done every 2 years?
Yes.
Is that correct?
Yeah,
okay.
Every 2 years.
Okay.
Okay, that's the biggest increase on the page. We did have an increase in turnout gear. And we expect at least 5 to 7% increase per set a year. And we need to rotate out 15 sets this year. So that was that increase.
Okay. Any questions before we go on to apparatus?
In terms of the recruitment activities, looks like we're keeping that number pretty flat. How are we doing overall with recruitment? And that number seems to be a good number, like, or how is that working as far as attracting and retaining folks?
That's a very good number. We are probably, I couldn't even tell you the percentage, 15, 18% higher than we were 5 years ago when we began the International Association of Fire Chiefs Recruitment Grant. We're bringing in, last year was a good year recruiting, actually. We got a very nice mix of experienced and certified members as well as new members. We're bringing in about one a month. But we do have attrition. It is a very demanding cycle here, and but we are bringing in about one a month, and our numbers right now, I believe we're at 73.
Thanks.
The 73 represents your volunteers.
Yes.
Thank you. Okay, why don't we flip the page then to 52 and 53 and look at apparatus maintenance.
Mayor, can I just go back for a question?
Of course, yeah.
I realized I was on mute. Chief, on the firefighting side, I follow some of the fire department's Facebook posts, and I seem to realize a lot of your calls fall on the on 91 on the state highway. Is there any opportunity for refunds or reimbursement from the state for the work we provide on Interstate 91?
That's a great question. Actually, our call volume on the highway has dropped a little bit, but there was a 6-month period where it was about 15% to the highway, 12 to 15% to the highway, which is a big number. Turning the clock back many years ago, the state would provide money to the fire department to compensate for responses to the highway. I don't remember under which governor, but they tightened up their belt, and then they gave us a charge account with X number of dollars at the Connecticut Fire Academy. You can go for training, books, equipment, whatever you need was up there. that went away. And now there's no reimbursement on the highway or for the state roads. However, I do understand through the Connecticut fire chiefs that there is talk about bringing it back. What it entails at this point, I don't know, but they're beginning to discuss that.
Thank you.
Okay. So let's go to apparatus maintenance. Anything here, Chief, that specific or?
No, with the cost to maintain the apparatus did drop a little bit. And I give credit to our mechanical staff, and even though it did drop, we're able to change, do a complete battery change on all the apparatus this year. So that will be well within the budget. So and we're in good shape apparatus wise. Thank you.
Any questions on this comment?
Yeah, one question, Mike, I don't mean to hit you offhand. How are we looking with that referendum that was done a few years ago with new equipment? How's the new equipment holding up, and is it meeting all your expectations?
It absolutely is meeting and exceeding. Along with the new equipment, there was a new shift in how we were doing business with the capital apparatus and the support vehicles, the utility trucks, and it's working out quite well. The new equipment is really holding up well. We did have a couple problems with the engines, with some seams in the roof leaking.
Warranty though.
But it was all under warranty through Sutphin, and we've had no problems since then. And because of that and a couple other things, we actually got 5 years of pump testing out of them. So I think we're into year 4 now.
So if we had not done the referendum and you were still continuing to Band-Aid some of the old apparatus, you're seeing definite cost savings right now.
Oh, absolutely. Absolutely. Yeah, we are down from where we were 5 years ago. We got to the point with some of the engines and trucks. First of all, we were apparatus heavy. We were able to streamline or right-size the apparatus fleet. But we were to the point when we were looking for parts, we were on eBay and on the internet and just hook or by crook, finding used parts. Some of the frontline engines were close to 30 years old. And a lot of technology changes in the 30 years. There were a lot of new standards, acceleration, deceleration standards, rollover standards, right down to seatbelts. So yeah, this new apparatus is really working out for us though, John. Thank you.
Good, great to hear. All right, thank you.
Yeah.
Anyone else like to make a comment?
Did we get, I know we were like cycling out the PFAS chemicals for firefighting.
Yeah, triple F foam, yes.
Did we get rid of that, or do we have exposure to that still? How's that looking?
How about almost? We did do the switch out and change out our onboard foam and our house foam. We changed it to an encapsulant that was PFAS free. And we changed that last budget year. About a week ago, the state sent us an email about collecting our PFAS foam. So Clean Harbors under the state is going to come and collect all our old foam. And I think the inventory off the top of my head was close to 500 gallons of concentrate, which would make at 3% makes a big mess. So that'll be happening very shortly. We don't have a date. And the new encapsulant is working out very well. We find that when we do go to fires that need the encapsulant, we are using a lot less water. It's a lot less labor intensive to achieve extinguishment.
Good. Yeah, that was going to be my next question was how does it compare? So that's good to hear. Thanks.
Oh, a lot better, a lot more efficient.
Perfect. All right. Well, If there aren't any more questions, I think that concludes your presentation.
Thank you very much for having me.
And, on behalf of all of us, Chief, thank you for getting us through the past year and a half, especially this past year with everything that you're doing. And that number, 11,000 times leaving the house, is remarkable.
It's amazing the commitment of this department. Like I said, I couldn't be more proud of them.
Yeah, and all on a volunteer basis, we have a lot to be thankful for. And so thank you for your leadership and getting us to this point and in a safe manner.
Thank you.
You're welcome. Have a good night. All right, let's move to insurance, property, and liability, and we will turn our books to pages 96 and 97.
Yes, that's the LAP policy. I guess it's liability, auto, and property. The town is still with Kerma. The insurance company agreed to go with them for another 3-year program this past spring. And what we saw is a increase in the premiums for workers' comp of about 3%. And on the LAP side, about 5%. Some of that is a high percentage that is driven by market conditions, from what we're told. It's a hard market out there. And also there's few companies in the market, fewer companies to insure municipalities and schools as well, because we also do provide insurance for the school buildings as well as the town buildings, and the workers' comp premiums come out of for the school comes out of this account here. We did add one policy to the multi-peril relating to cybersecurity. Kerma used to provide I don't know the right term, but I guess a policy to all their members. And then as the claims come in, it would reduce down the amount of claims that they would pay until it gets to zero. So if it was like $1 million and claims came in associated with cyber, they would pay those claims out of that until the end. They discontinued that and encouraged towns to go and get a policy of their own. So Rocky Hill did that just to protect itself in case we do have a cyber attack. And I think that pretty much wraps up the insurance side.
Well, the only one who I know on this council who likes to talk insurance is Deputy Mayor Sharman. So I'm going to toss it to him first. And do you have any insurance stuff?
None. I was wondering what the dividend back was this past year. 20,464.
Yes.
Yeah.
Because I think you had mentioned that during the year, and when we used to get around 50K back on the dividend. The program was running pretty smartly. Is it a combination of some claims that we're having, maybe, or is it so Kerma? The program is a captive, and it when the results go down, they can pay less back to the members of the captive or the owners of the captive town of Rocky Hill. So was it a loss ratio thing from our point of view, or was it experiencing as a pool experiencing problems meeting that higher dividends?
I would tend to think it's probably be driven more by the pool that brings down the reduction. But then, as you said, I think that would be the major portion. But then I think also, to be fair to the towns, I think they also look at the individual towns and make an adjustment accordingly. Now, I'm not sure. I know we've had a couple large claims associated with those pylons down in the Connecticut River when the ice came down that one year, as well as our fire trailer that got destroyed during the windstorm. So where those fall into place, I'm not sure in this calculation, but we do have some fairly large claims that could impact our dividend.
Yeah, yeah. They've done right by us for now. How many years? It's been pretty close to 10 years, I believe, or more. 15.
I don't think it's that high. Maybe closing in on 10.
Closing in on 10 years, and we're always getting some money back.
Going on 10,
Yeah. That's the only thing is I was just wondering if their results were starting to suffer and they were seeing more liability claims. That's something we have to watch going forward. If the police departments are taking liability claims, heavy liability claims from the Police Accountability Act, we'll have to watch and see if the insurance organization starts to suffer financially because of that.
All right. Are there any questions or comments on this line, on this budget? Okay, hearing none, we'll turn the page to 94 and 95 employee benefits. Or actually, we'll flip backwards.
Okay, so this line covers the health insurance, a group life policy of $20,000 for all employees paid by the town, a long-term disability plan, as well as the pension contribution and associated costs with that. And we also do pay all employees town's share of Social Security, except for the police department, who does not pay, police officers who do not pay Social Security, and our token deposit to our OPEB trust. As you can see, the health insurance, we've switched over now primarily 5 groups, 4 unions, and the non-bargaining will be switched over to the high deductible health plan starting in July of this year. We have 2 unions left to negotiate with, whose contracts come up June 30th, MEIU and the police department, with the same goal is to try to get those membership on the high deductible health plan following similar offers that were made to the previous negotiated union settlements. The pension contribution went up because I think it's more of timing and when the valuation is done. After the COVID hit back in the March, April time period, the equity markets and the investment markets did take a large dip, and then they eventually started recovering. So when the employee and the police are of course the 2 largest pensions. So when they did their valuation back in September, the police and the town employees' assets and their plans totaled a little over $70 million. To cover the actuarial liabilities calculated for future benefits to be paid out. Looking at how the assets stand in April, due to the increase in the equity markets and the investments, those assets now total $83.7 million. So again, as Chris asked earlier, I think as long as the assets in the pension plan continue to grow with the good equity and investment markets, we should probably see those contributions drop in the coming future. And okay, that covers. I think that. What I wanted to cover.
Okay.
So, John, quick question on the pension fund. Are the employee pension fund, this one, Town of Rocky Hill General Employee Pension Fund, include the ambulance and the fire? The bond
There are four separate pension trust funds.
Okay.
One for general employees that include town employees and Board of Ed employees that aren't certified, or teachers, I think. And then there's a one exclusively for certified police officers. And then there's a plan for the fire department and a separate plan for the ambulance. The ambulances and fire are based more on a fixed dollar amount, depending on years of service and the rank that you may have achieved during your time period. Where the other two are based on years of service and your salary. Put it.
Okay. And up till now, we are funded 100% on those, all four of them?
Right. What's happening in in police and the general employee plan is, as in the prior years, as union contracts were negotiated, those pension plans, the defined benefit plans, got closed to new employees. So currently, all new hires go into a defined contribution plan, which in general, the employee pays 6% of their salary and the town pays 3%. So they match 50%. And then it goes into, like a 401k type of plan where the employee can choose how they want to invest their contributions. So the switch has been more on the employee to manage their 401k for their retirement fund, as opposed to the defined benefit plan, which is a calculation based on those two components that the town is responsible to match.
Yeah, no, I completely understand. I guess the question is like, I guess the better way to phrase it will be, is the employer side of our contribution, like we make it every year, right? The 3%.
Yep.
Right. Okay.
Yep.
Okay.
But as we're seeing people retire, no new employees are going into the defined contribution plans because it technically is closed right now.
Okay, thank you. All right, we can turn the page now to 98 and 99 and discuss contingency reserves.
The contingency is what it says to cover for unforeseen expenditures that may occur during the budget year, as well as we offset our employees that retire that qualify for payouts, especially on those that have accumulated sick time over their years of service, gets charged to that, as well as salary increases as results of the of union contract negotiations. So we did increase it by 50,000, primarily due to the two union contracts that were that are expiring on June 30th to help cover any increased costs that may be incurred due to salary increases as a result of those negotiations.
Okay, thank you. Any questions? Any other questions?
Yeah, I just have, so John, it looks like we're projected to use 375,000 in the current fiscal year. So there's what, about 80,000 of unused amount versus the adopted budgets. Is that, you think that's going to hold true?
No. As you heard, we've been getting retirements coming through, so that money will probably be going towards paying out some of those sick time payouts. Beside the two you heard tonight, we have two people also retiring in the police department.
Right. So where do you think we'll end up on our number, roughly speaking, or?
Roughly speaking, yes.
Okay. If there's nothing else, we can wrap up with paragraph H, debt service, beginning on pages 88 and 90, 88 and 89, excuse me, in talking about principal.
Okay, so the town has 7 long-term bonds outstanding, and that's the schedule listed on page 89 of the principal payments due in the coming year. Some of them are increasing, like the Stratster one increased next year over this year due to the premium that the town received when they sold the bonds initially. That premium was used up in the 2021 year. And also note that the one on the bottom will be coming off. We're making the last payment on our 2010 refunding bond. But the other side is that we're starting to work towards doing a bond issue in July associated with the bands that were purchased back in a year ago, July, for the raise funding for the community center, senior center project, as well as the road improvement program. So that's currently, plus our high school project that we're waiting for the state to close out. So that was about 11.3 million. Moving forward, we're probably going to do the 250,000 rollover of the high school project in the bands, but we're looking to bond the community center at 7.1 million, and plus the rolling over of the $2 million from roads, as well as an increase of another $2 million for the coming year road improvements. So the bond is scheduled to be tentatively set at 11,100,000, and that would close sometime the end of July. And as I mentioned earlier, I think in finance, where the town's looking to do a refunding on the 2014 general obligation bonds. And we are waiting for the federal government to allow municipalities to do non-taxable bonds, refunding bonds, and that would increase our savings at least double, if not maybe triple, on the hopeful side. So we're monitoring that, and when that becomes available, if it comes available, we'll move on that to try to reduce our debt service payments even further.
Okay.
Do we have
sorry. Go ahead, Chris.
Just John, following up on that last question, do we have a ballpark on what the savings would be for the refunding of the 2014 bond, and would that be this year, or we have to recognize it in the next year's budget?
As of right now, we don't know what the savings would be. Hopefully, we could. That will go through so that we could do it so it would affect the next budget. Probably not next year's budget, but the following year's budget. And depending on how it plays out, the savings could be associated with the principal and bond payment that were budgeted for. That funding may not be necessary due to the restructuring of the debt.
Any follow-up? All right, so should we wrap up with interest payments on page 90 and 91?
That's
So we're good?
The interest payments are what they are. That's the interest due that year. Generally, it's a declining amount due to principal payments, reducing the amount of interest being calculated. So most of them are in negative except for one, which relates to the $61,000 increase, relates to the bands that will be maturing in July. That interest payment, we only pay interest on the bands, no principal. And then the other one down below it, the 237, relates to the Stratsker Farm premium. And I'll end the interest payment short.
Okay. Any comments or questions about interest?
That I wanted to jump back to the bonding for a question I just thought of, John.
Yes.
Is set the total. What is the total of all our bond referendums?
Well, on the principal page, it lists the bonds, their original issuance cost, and then what the balance would be at the end of this fiscal year, end of this budget year, excuse me. So,
I mean, I guess what I'm asking you is we're not, some of the bonds we are not, so we have a $10 million bond for X. Some of them are coming in, we're not using all of the money, and we're not taking all the money, correct? Some of the bonds, some of the uses of the bonds, we did, like the Mosher School, we did not use everything that we bonded for, so we didn't take all of the bond. Is that correct?
No. We went out to referendum for about $48 million. These are rough numbers. When the project got completed, let's just say it was 38 million. And then the town would reduce its anticipated reimbursement from the school building, the state building, school building department, to reduce down what we're actually going to bond. But we can only bond for what we actually spent for. We can't bond and then have that money sitting out there. That's not allowed by our bond council as well as the IRS. And I don't know if we want to go live in Danbury for a few years.
Okay.
But no, the Mosher School did come under budget, but we only bonded for the amount that we anticipated cost the town, subject to, the grant reimbursement from the state on school construction grants.
Well, I guess what I'm getting at is at one point our approved bonding capacity was approaching 100 million. But I don't think we're even, I guess because the projects were coming in for less, or we were accomplishing them for less, the actual bonding amount is coming in far less, and that's the 72 million.
Well, there was a couple of things you stated. There is a calculation that's done in our audit report that says the total amount that the town can bond in total based on certain types of categories and so on. And generally those are in the well up above $100,000. As we go out and bond, then it increases our debt service and principal. But as we pay as every budget goes by, we pay it down. So we do reduce the amount that we did have outstanding at the time. So as of the June 30th of 2022, we'll have $72 million plus the new issue that we're going to do in July. So it'd be closer to probably $83 million ballpark will be our outstanding debt as of June 30th of next year.
Thank you.
Okay, thank you. All right, well, I guess I will entertain a motion to adjourn.
Madam Mayor, motion to adjourn.
I'll
Second. All right, all in favor?
Aye.
Aye. All right, thank you, everyone. John, when is our next budget meeting?
We have one scheduled for next Tuesday And it's related to CPI. If you want to hold it at that time, you can. At finance next week, I'll put out the resolution for postponing the adoption of the budget instead of the third Monday in May to be adopted sometime before June 30th of this year.
Perfect.
So that will extend it. So if you want to not do that, that option's available. You can do it at a later time.
Perfect. All right. Thank you. All right. Good night, everyone.
Take care.
Bye.